I talk about reversible loss of vision in malignant hypertension. Definition: high blood pressure can place a strain on the blood vessels in the eyes. HBP can cause the blood vessels to either narrow or bleed when they are subject to too much blood pressure force. Also, the optic nerve might swell, reducing the ability to see well.
High blood pressure can affect the eyes in multiple different ways. So most commonly, people who have long-term chronic high blood pressure, they develop slow changes where the blood vessels start getting thinner, they start to harden, and then the blood doesn't get to the tissue quite as well, and that does the retina won't work as well. It can cause something called retinal vein occlusion, whereby basically you have a stroke inside the eye that can cause a hemorrhage and vision loss. And then also acutely, if you have a sudden spike in blood pressure for some reason, that can cause swelling of the optic nerve, and that can also cause decreased vision. And in the eye, when we can find these changes, then that is highly suggestive to us that there's changes elsewhere in the body, and that a really thorough exam and coordination with the primary medical care doctor needs to be done.
Okay. Applications in medicine. A 35-year-old man with reduced vision in both eyes had no relevant medical history apart from intermittent headaches. On physical examination, the best correct visual acuity was 2018 in both eyes. Fundus exam revealed bilateral disc edema, macular edema with lupus erythematosus, splinter hemorrhage, and cotton wool spots. The funduscopic findings prompted an evaluation of blood pressure, which was elevated at 119/100 millimeters of mercury. The patient began antihypertensive therapy, and after 1 month of treatment, his blood pressure was 120/19 millimeters of mercury, and the visual acuity was 20/13 in both eyes, with resolving disc edema and macular edema. Okay, pros. Loss of vision does not occur immediately or sudden, so it may be reversible if treatment is done on time.
My name is Reggie Murphy, and I put together a short video here on eye strain symptoms, and I hope you find it useful. When the eyes are used intensely or for long periods of time, eye strain may occur. Straining the eyes can cause a variety of uncomfortable symptoms, but in most cases, resting your eyes will provide some relief. Unfortunately, many individuals do not recognize the symptoms of eye strain, which means they may not take the time to rest their eyes when they need it. Once you become more familiar with the common symptoms of eye strain, you'll be able to easily recognize them and realize when it's time to take a break and give your eyes some rest. While there are many signs of eye strain that may manifest themselves, not every individual experiences all the symptoms at once. If you notice you are experiencing a few of the symptoms, it's time to make some changes. One of the main signs that you may be dealing with eye strain of your eyes is that your eyes are tired, sore, itchy, or burning. Often your eyes may feel dry or begin watering as well. Another sign to watch out for is double vision or blurry vision. The eyes may be having a tough time focusing when eye strain occurs, causing these vision problems. Some individuals also notice that their eyes become quite sensitive to light, or they may have a tough time focusing on a task. Surprisingly, the signs of eye strain don't just involve the eyes. One of the most common symptoms of eye strain is a headache. A headache along with sore and tired eyes is a good indicator that you are suffering from this problem. Many people also encounter pain and soreness in the shoulders, back, and neck. In some cases, lightheadedness, nausea, and dizziness may occur. Some of the other common signs that you may be dealing with eye strain include eye twitches, a feeling of heaviness in the forehead or around the eyes, problems reading, and fatigue. If you are experiencing any of the signs of eye strain, it's important to treat this problem. In many cases, making some simple changes to your environment or work habits can help improve the problem and reduce the symptoms. Reading glasses may be prescribed to help reduce eye strain. Underlying eye conditions may need to be treated to help reduce problems with eye strain. Doing eye exercises may help as well, helping to reduce the strain on your eyes. Using plenty of light when you are working close up can be helpful. Reducing glare on a computer screen can help reduce eye strain. In many cases, simply resting your eyes and giving them a break can be enough to reduce the symptoms that you're experiencing, providing some much needed relief. I hope you found this video helpful and look forward to making some more in the future.
Okay, counts. High blood pressure can damage the vessels supplying blood to your retina, causing retinopathy. This condition can lead to bleeding in the eye, blurred vision, and complete loss of vision. If you also have both diabetes and high blood pressure, there is an even greater risk.
If left untreated, hypertension can lead to a thickening of the arterial walls, causing its lumen, or blood passageway, to narrow in diameter. As a result, the heart must work harder to pump blood through the narrowed arterial openings. In addition, people with hypertension may be more susceptible to stroke.
Okay, conclusion. Malignant hypertension can result in acute, substantial loss of vision owing to ischemic optic neuropathy and cerebral maculopathy. Prompt diagnostic and treatment might restore vision and retinal anatomy without any intervention in the eye.
Among people who have high blood pressure, 30% don't even know about it. And that's bad news because untreated hypertension causes thousands of deaths each year.
As many as 65 million Americans over the age of 6 have high blood pressure, also known as hypertension. So what are the consequences of this epidemic? A stroke, which affects the arteries leading to the brain, is one of hypertension's most serious consequences. Strokes are caused by a clot obstructing the flow of blood to the brain, or by a vessel rupturing with the same result. Al Capone is best known for his life of crime in Prohibition America, where he was heralded as the boss of a criminal organization in Chicago. What many people don't know about Capone, however, is that he suffered a stroke while in prison, which led to his demise at the age of 48. People with hypertension are 8 times more likely to suffer from strokes like Capone's than people with normal blood pressure. In fact, high blood pressure is identified as the #1 risk factor for strokes. People with hypertension are also twice as likely to suffer from heart attacks. A heart attack occurs when the flow of oxygen-carrying blood to the heart is blocked. Like strokes, heart attacks can result in death. High blood pressure is also the #1 risk factor for developing congestive heart failure. This serious condition occurs when the heart is unable to pump enough blood to supply the body's needs. In addition, people with untreated hypertension often suffer kidney damage or even kidney failure. The kidneys act as filters to rid the body of waste. Over time, high blood pressure can narrow and thicken the blood vessels of the kidneys, making it difficult for them to do their job and resulting in waste buildup in the blood. High blood pressure can also affect the arteries and smaller arterioles throughout the body. As we age, our arteries harden and become less elastic. While this occurs gradually in all people, those with hypertension experience a speeding up of the process, causing the heart and kidneys to work harder. Even the eyes are not immune to the effects of hypertension. Long-term high blood pressure can eventually cause vessels in the eyes to burst or bleed. As a result, vision can become blurred or otherwise impaired. In some cases, total blindness can occur. These consequences are frightening, but the good news is that they are avoidable. Clinical trials have found that lowering blood pressure to acceptable levels can reduce the risk of stroke by 35%, the likelihood of heart attack by 25%, and the occurrence of heart failure by 50%. If you have hypertension, or you think you may be a candidate for developing the condition, please talk to your doctor about treatment options.
Want to learn more? Check out other videos.
Okay, thank you.